On this episode of Test Don't Guess Tuesday, we are going to talk about a 28-year-old client of mine who presented with some pretty severe constipation. She hadn't been able to resolve it for a number of years now, had tried pretty much everything recommended by her doctor, including laxatives, over the counter, things like Miralax, as well as prescriptions like Linzess. The first thing we did when she came was to run a stool test because we really need to understand underlying root causes and what was happening. So let's take a look together at what was going on in her gut. For the sake of time, I want to talk about this page of the GI map. Obviously, it is 5 pages long. Everything else on her test was fairly normal. She did have a little bit low elastase, and we did supplement for her with some digestive enzymes. However, when we came to this page, we did a hard stop with H. pylori being high. So her biggest symptom was the constipation, and this is the culprit. For those of you who don't know, H. pylori is a bacteria that infects the lining of your stomach. It burrows into the stomach lining. Number one, can cause some pain. Number two, it releases an enzyme while it's there. And that enzyme's job is to lower the acidity in your stomach so that the H. pylori can survive. The lowering of the acidity of your stomach causes problems at both ends. So a lot of people will, with H. pylori, will experience some acid reflux because when there's not enough acid to cause all that food to be digesting and moving down, it's sitting there and sometimes coming back up. And number two, when your stomach is not acidic enough, it often results in constipation because food is not properly broken down in your stomach. So as it makes its way into your intestines, transit time is slower. So H. pylori is the first thing that we want to handle here. You will notice here at the bottom too that both Bacteroidetes and Firmicutes, right, those are phylum of bacteria, they're both high. And what that's telling me is things are starting to become overgrown because there's not enough acid to keep it in check, right? However, if we were to just raise the stomach acid here, this client would be much sicker with probably a lot more stomach pain. When we're dealing with H. pylori, first we eradicate the H. pylori, and we will use some herbs to do that. And then we will raise the stomach acid, and that will take care of some of the overgrowth in her gut. You can see that the commensal bacteria, all of these guys in the middle of the screen here, back from Bacteroides, fragilis, all the way down to Roseburia, everything really does look beautiful there. And so I would just want to bring levels down a little bit by fixing that H. pylori. So my goal with this client is to resolve the H. pylori, then to raise the stomach acid, and I would expect that the constipation would resolve fairly well. I also would look at the other root causes. Remember, there are 8. And with this testing, right, this is number 8. When we can't resolve it with other things, we can look to testing, or we can test first and go right for it. But remember, the other 7 root causes of constipation are lack of hydration, right? Improper diet, whether it's food sensitivities or not enough fiber or a combination of the two, a sluggish liver, non-alcoholic fatty liver disease affecting lots of people, affecting our constipation as well, stress and anxiety, very common, affecting bowels, especially if you have a morning routine that makes you feel like you were shot out of a cannon. That needs to change so that you can wake up and have that morning bowel movement. Also, medications, if you are on a list of medications, you should be reviewing those with your primary care or whoever wrote those scripts for you to make sure that those medications are not constipating, because often they are, and they won't tell you that, and then you're fighting this battle against constipation when you're continually taking this medication, right? Mold and parasites is a big reason. We don't often pick up parasites on the GI map test, And mold, this is not a test for mold. However, both of those can completely shut down the bowels as well. So we take a look at all of those factors, combine it with what we get in the results of this test, and this would be my protocol for this client, right, going forward. And in fact, that's what we did. Like I said, she's 28 years old. She had been suffering for a long time. It took us about 4 or 5 months to get this under control. And so we eradicated the H. pylori, we raised the stomach acid, and her bowels came back into balance, rebalancing the microbiome. So that is Test Don't Guess Tuesday. It's why we run these tests, right? If you hadn't known that this was an issue, this H. pylori was lingering, lucky for her, the virulence factors are negative. Remember, if you have positive virulence factors, you are at high risk for developing autoimmune conditions. She didn't have that, and we were able to reverse it. So she probably would still be struggling with everything that came down the pike, every new pill and gadget to resolve her constipation, if we had not found the H. pylori, the bacterial overgrowth, and rebalanced her microbiome. So that's it. I'm Melissa Klepacki. This is the work that I do every day. I work with men and women around the country, taking them from constipation to liberation by understanding root causes. Thanks for spending a few minutes with me. Stay tuned next week for next week's Test Don't Guess Tuesday.